Yes, prednisone is a blessing and a curse for sure. So if you've ever taken it before, there's something that you need to know. And I almost guarantee that your doctor never told you this. So you've heard of non-steroidal anti-inflammatory drugs, NSAIDs. Well, what we're talking about now is steroidal anti-inflammatories, and these are called corticosteroids. They are powerful anti-inflammatory medications. And they're actually really structurally similar to the cortisol that you make inside your own adrenal glands, one on top of each kidney there. And you've probably heard of prednisone. That's one of the most famous drugs, but there's a whole bunch of others that can be used in all sorts of different ways. You can take them orally in a pill, as a tablet, or inhaled for asthma and related conditions, topical for skin problems. They're used by injection as well. And yes, they are potent anti-inflammatories, but you want to avoid these drugs if you can, and you want to minimize the dose or duration that you take them if at all possible, because they have a long list of side effects, especially when they're used at high doses over the longer term. And I'm talking about immune suppression, osteoporosis, insomnia, agitation, high blood pressure, weight gain, and yes, for a lot of people, this moon face and a buffalo hump on the back of the neck that often comes along with it. But there's also another side effect that doctors almost never talk about. So it's this: prednisone depletes your supply of a handful of different nutrients. And the big three that prednisone depletes are vitamin D, calcium, and chromium. And then there's also magnesium, zinc, potassium, vitamin A, vitamin C that are all depleted by prednisone. So listen, the lesson here is to avoid prednisone in the first place if you can. And the way you do that is by doing all the stuff that you know you should be doing. Eat an anti-inflammatory diet, do regular physical activity, prioritize your sleep, stress management, reduce your exposures to environmental toxins whenever you can. All these things will help you avoid getting chronically ill or help you have a less severe course if you ever do get ill. And then if you do need prednisone, you try to keep the dose low and the course short. And then please have your vitamin D and your calcium levels monitored. Consider supplementing with D, calcium, chromium, magnesium, potassium, vitamin A, and vitamin C, and you will feel a lot better.